Okay, everyone, I would like to welcome you all to tonight's extended learning call with Karen Ahrens. I'm excited to have her talk tonight. She is my expert nutrition folk, and I've learned a lot over the years from Karen. So I'm happy that she's able to do this tonight. And we're recording this, so I am going to make Karen a co-host, and then she will be able to share her screen with you. The other thing is that the slides for this presentation I will send out to all of you tomorrow morning, and then the recording will also be up on our website if you want to share it with other individuals. So without further ado, Karen, I'm going to let you take it away.
Well, good evening, everyone, and thanks so much, Deneen, for the invitation. I'm Karen Ahrens. I'm a registered dietitian. I'm here in my home office in Bismarck, where I've worked for a lot of years. So I was just ready to slide right into working from home. I'm fortunate to be able to do so. I'm really glad to be here tonight to talk about ways that if you are looking for help with food, where you might be able to find some ideas to find food. And if you're someone who wants to help others, also the ideas are for you too. And always working to help prevent disease and keep people healthy before they get ill. And so now especially has been a really important time for us to keep healthy, to keep our immune systems healthy. As you've maybe heard, that people with not only weakened immune systems, but also people with chronic diseases like diabetes, heart disease, and cancer are having more difficulty in fighting off the COVID infections. So it's a real good time to brush up and try hard to make as good a choices as you can with the resources that you have for yourself and your family. I'll switch over now to my content and try not to be too slow or dumb about it. Here I go. Let's see, screen. Okay. And then I'll get to my right folder. And hopefully now you can see a screen with a blurry picture of carrots.
Oh, we can.
Okay, good. Little attempt at some artsy and interesting ways of looking at food here. And we'll head on. I'd like to start off asking people just to think about all the different places we find food, no matter where we live. These are some of the ideas that I have put together, ranging from the first food of breast milk to growing our own food, foraging for food that's outgrowing in the prairies, in forests, hunting and fishing. We get and find food at the family dinner table. We purchase meals away from home, from the typical places like restaurants, but also convenience stores and fast food. We get grocery ingredients from stores and big box stores. You can even buy groceries at the hardware store and at dollar stores. We sometimes eat at work. There are meals for children at childcare centers and childcare homes. We have WIC and SNAP to help purchase foods. There are meals and snacks at schools, backpack programs that help kids take home food over the weekend, summer food service programs for children in schools and community centers. And then there are food pantries, soup kitchens, homeless shelters, community meals, home delivered meals for elders, Meals on Wheels, and senior meals in community settings for seniors. And there's also meals served in healthcare and long-term care facilities. Does anyone think of any other places that where we get food or find food that I didn't think of? So I like to think about places where we can find food and places where it's getting to be further apart in North Dakota where we don't find food. So this map is now needing some updating, but it's the most recent one we have for North Dakota, and working with our Rural Grocer Initiative, we're able to map out the places where people live less than 10 miles to a grocery store. And those are the places shaded in green, to places where people live more than 10 miles to get to a grocery store. And we sometimes call those food deserts. So no surprise, the western part of the state has farther spaces apart between sources of food than the eastern part. But there are some efforts to help keep those places to find food open. Some communities have started cooperatives, others have community efforts where their cities might lease out a building for a very reasonable rate. There's even a great cooperative project up in Walsh County that's putting about 5 different communities and their grocery stores working together so they can buy food in larger volumes and at a better discount. So there are efforts to address that, but there are some pretty far places that people have to travel to get food unless they're self-sufficient in growing or hunting their own food. And yet this is happening in a state that grows the ingredients, as they like to say, feed the world. We lead the production of at least 10 crops in the United States. And yet a lot of the food we grow here leaves the state in a form that's not ready to eat and comes back to us in boxes, cans, frozen packages. In the last year or so, especially, that's caused us to be in a difficult situation. There were about half the school districts in the state who had signed a contract to purchase food with one distributor. And because of the supply chain disruptions and personnel shortages, that company broke off and terminated the contract. So schools were left scrambling to find new distributors, new places to buy food, working together. We heard a report today from the Department of Public Instruction that this time that we're living in has had a silver lining for them, in that schools are becoming more flexible and creative and working together in ways to find food. And here I've just added some photographs of some of the foods that we grow, starting up in the north corner with the yellow flowers of canola, some locally grown vegetables. We do have an herb farm in North Dakota. We grow a lot of dried beans and peas, eggs, fruits, vegetables, wheat, of course, garlic, and pulse crops like lentils. So we do grow a lot here. And there's some focused thought in helping to shorten those supply chains so that we're not relying on a lot of out-of-state shippers to get our food here. I've had the great honor over the past 12 years to be the coordinator for our state's anti-hunger coalition called Creating a Hunger-Free North Dakota. And I'll complete my time with the coalition at the end of this year. So this is one of my last presentations I'll make as the coordinator. Changes are coming, and the facilitation of the coalition is going to change over to the Great Plains Food Bank, and we'll be hearing more from them coming up. But I've had this great opportunity to work with many diverse organizations in the state, ranging from those who grow our food to the usual suspects of the food programs and the state agencies that they're housed in, to nutrition and health groups, women's groups, worker organizations. One of our most unusual but fruitful partners has been the North Dakota Association of Rural Electric Cooperatives, where we've been working on the Rural Grocery Initiative. So just a lot of great organizations coming together, including spending time with Deneen and Family Voices. Even though we grow a lot of food here, of our last count, which is done by the Department of Agriculture, USDA, we still have about 25,800 households in our state that face food insecurity. That means they don't have enough food every day, or know where their next meal, that they're sure that their next meal is going to be coming. And that includes about 16,360 North Dakota children. And that's one of the hardest things, and the things that motivates me to do this work, is to, especially for children. As you can guess or heard, or hopefully didn't experience, that during the first part of the pandemic in 2020, when work was being stopped and people weren't going to work or couldn't go to work, and we really didn't know what was going on even more than now, there was a sharp reported increase in the number of households with children who reported not enough food insufficiency. So about 1/3 to half of adults who answered this survey from the Census Bureau said that they lived in households with children where they weren't finding enough to eat. After that time of July, things got better when some of the federal food program and economic assistance programs began to kick in, the COVID checks, the farmers to family food boxes, the extra programs through the SNAP and WIC, and school meals, has really helped to bring down that number. Just kind of an interesting way to look at things. As people needed assistance because they weren't working, or their businesses weren't open where they did work, between February 2020 and January of 2021, there were about 19% more people participating in Medicaid in our state. There were about 8% more people participating in SNAP, and fewer people participating in WIC, which was very interesting. And it happened across the nation. We're not quite sure why, but they're starting to see more families coming back to the WIC program. I had the opportunity to pull together the responses of many of the organizations in our state. And if you're interested, you can follow this link to our website and read about some of the responses that range from, again, state agencies changing their hours, being open, more being done online, more being done on telephone, changes in the amounts of assistance that were given, free school meals for everyone going to school last year and this year, are just some of the things that took place. And we know that still there are people who struggle with tough choices every day, especially people who are on fixed incomes or have one income in the house. And the people impacted most are households where there's a single female head of household with children. They experience the highest rates of food insecurity, but also do single head of households headed by fathers also have, when there's only one person earning an income in a household, it makes it harder to find the resources to buy food. And 75% of Great Plains Food Bank clients have reported that they live with some kind of chronic disease, and 84% of those folks have more than one. So there are people who have illnesses and are struggling with tough choices like, do I buy food or put gas in my car? Do I buy food or pay for my utilities this month, and housing and transportation? So there are people in our state forced to make really tough choices, but there is help. Feeding America, which is the network of food banks across the country, even says that the charitable sector cannot solve hunger alone. And the Great Plains Food Bank is our Feeding America organization in the state. So for about every one meal that Feeding America provides, SNAP provides 12 meals. So it takes all kinds of programs working together to help make sure that people find enough to eat. Going a little bit more into the SNAP program, it serves around 54,000 North Dakotans, and 3 or 4 out of 4 of those families have children. And 1 out of 3 of those families have members who are elderly or have a disability. The great long-term benefits of SNAP for people who participate in it is it first reduces food insecurity and hunger. It has lifted people out of poverty, including children. There are better health outcomes for children who participate and their moms who are pregnant. People who get enough to eat through the SNAP program and other programs have an increased likelihood that their children will graduate from high school. If you're not familiar with SNAP, SNAP benefits used to be called food stamps, come on a card called an EBT card, which is like a debit card once a month. Not only can you purchase food with a SNAP card, you can purchase garden seeds to grow your own food. SNAP can't be used to purchase beer, wine, or liquor, or cigarettes, or tobacco. There is SNAP nutrition education that goes along with that, and that is run through the NDSU Extension Program, Family Nutrition Program in North Dakota. And the average benefit per household in North Dakota is about $242 a month. I like to remind people that SNAP benefits communities because some people forget that there's money coming to households and they purchase food here, which supports the stores that sell the food. So every $1 in SNAP generates about $1.70 in economic activity in North Dakota. So SNAP dollars coming to our state support the grocery, the workers, and our economy as well. Some new things that are happening in SNAP is that there are more farmers markets now that accept SNAP. From Bismarck, Fargo, Grand Forks, Rolette, Rolla, Spirit Lake, Stanley, Wahpeton, and Washburn all host markets that accept SNAP, and you can use your SNAP EBT cards there. So that's been a really good improvement in the last few years. And along with that, there have been some programs that help people's SNAP dollars go further. There are incentive programs in North Dakota called Double Up Bucks. And so for every dollar that you use to purchase food with SNAP, the incentive programs find money resources to match that. And then people get, if you say they spend $5 in groceries, they get an extra $5 to spend on fruits and vegetables. And those things are going on in Fargo, Bismarck, Rolla, and Fort Yates. And they're working to get more going too. If you know someone or you yourself would like to apply for the SNAP program in North Dakota, it's based on your income. You can apply online. You can apply locally at your local human service office. And if you need help, you can find help at your Human Service Zone office or the Great Plains Food Bank. And here's the website where you can go to first look at to see if your family might be eligible. And or the Great Plains Food Bank has a person on the phone that can help you walk through some of the questions, help you get the information ready to be able to complete your application. Another program that I am an advocate for is the WIC program, which supports pregnant women and breastfeeding women and children up to the age of 5. So what goes with WIC is nutrition and breastfeeding education and support, healthy foods, and referrals to other community or healthcare organizations. A lot of people don't realize that if you're a dad, a grandparent, a foster parent, or any caregiver of a child under 5, you can get WIC for your child. WIC provides healthy foods and people are assessed for nutritional risk. Often women might be low in iron, children might not be getting enough calories or vitamins or proteins to support their growth. So the WIC is for specific foods called a food package, and it helps people meet their daily needs. What some people also don't know is that if you participate in SNAP, Medicaid, TANF, or Healthy Steps, you're automatically eligible for WIC. So if you receive benefits from any of those programs, you're automatically eligible for WIC if you're a mom, breastfeeding, pregnant, or a child up to the age of 5. I meant to also include the income guidelines for SNAP, but I didn't get those in here, but they're similar to WIC in that, or they're 185% of the federal poverty level. So you can call and talk to your local WIC office, which you can find on the Department of Health website, and they can help again walk you through this to find out if you're eligible. But just to give a guideline, if you are a family of 4 and your annual income is $49,025, you could qualify. And then they break that down by month, $4,000 a month, $22,000 twice a month. If that's your average pay, you can be eligible. Just a couple of years back, we had like 50% of the children in North Dakota were eligible to participate in WIC, and we're not reaching that many children. So please encourage people to take a look at their income levels and give a call in to find out if they might be eligible. Another place where a lot of folks find food is at school. And what is surprising to some, but not to everyone, is that a recent study found that schools are where children in the United States get their healthiest meals. So for adults, they get most of their healthier meals at the grocery store, but for children, it's school meals. And so for about the last 8 years or so, there's been 10 years, the Healthy Hunger-Free Kids Act, which helped to improve the nutrition value of school meals by making sure that the foods that are chosen to be served at school are lower in salt, have more whole grains, less fat, less cholesterol, and serve healthier. And it's coming to be true that right now, some of the healthiest meals for kids are served from schools. Just in the year 2020, there were 11 million lunches and 3 million breakfasts served at school, and 1 million lunches served at childcare in North Dakota. So school meals are reaching a lot of children in our state. I think I had just a couple of notes here that I wanted to make sure and talk about. And I guess I can pause too to see if people have any questions about school meals. There's also been an increase. With school meals, I wanted to make sure and say that school meals have been served at no charge for all children because of the pandemic. So everyone's getting free meals. And there's actually been an increase in the number of middle school and high school students that are eating breakfast, which is a really good thing to make sure that kids are fueling up to eat breakfast. And there are summer meals for youth during the summer, often served from schools, but sometimes from other community locations. And there's a real neat texting program that you can use when those programs are running. You can just text food to this number 877-877 and you enter your zip code, and then it pulls up a message in your text that tells you where for your zip code the nearest summer meals are. So that's a real neat thing if you can remember that to this until summertime. As it is right now, all meals served at no charge, but we have to start thinking about the next year, and I'm trying to figure out, sorry about that, how to make the sidebar go away. There, okay. So I can see the whole slide. Again, similar to WIC program, people and families qualify for free meals if their income is at 130% or less of the federal poverty level, and qualify for reduced price meals if their income level is at 185% and between 130 and 185% of the federal poverty level. So that breaks down to, for a household of 4 people, if the household makes less than $34,450 in a year, would be eligible for free meals. And if making less than $49,000 would qualify for reduced price meals. One thing that many people don't realize is that North Dakota, the state of North Dakota, kicks in and covers the costs for reduced price breakfast for all children who qualify for reduced price breakfast. So when we get through COVID and things change back to collecting meal applications and things like that, every child who qualifies for free or reduced price meals eats breakfast for no charge. Just a word, because we might be caring for parents or know people or getting to the age ourselves when we could participate in senior meal programs at age 55 and over. We have over 200 senior centers and dining locations in North Dakota, and we have Meals on Wheels. Those have been really important during COVID too, the Meals on Wheels, making sure that people, again, elderly being more susceptible to the COVID infection, have been able to access meals through Meals on Wheels. And I know most programs are always looking for volunteers, so that if you can help. There have been a few communities in the state that have served the senior meal programs at local cafes in a couple of places and not at senior centers. So because part of the reason for those programs is socialization, getting people out and eating with one another. You can find, if you need to help someone find senior meal programs, there's the North Dakota Department of Human Services Aging and Disability Resource Link website, phone number, or send an email. And also a link to where the senior service providers are in our state. There's a Hunger-Free North Dakota Garden Project, which has also been going on since about 2009. And through that, people who grow food in gardens can donate a little bit extra that they might have to a local food pantry. It's a project of the North Dakota Department of Agriculture, and there's a website where you can go to find out where you can donate fresh produce, where is the nearby food pantry who's happy to accept your produce. And that can give you some inkling of where the food pantries are that are likely to have some of our fresh garden produce that we're just getting through the season, but there are probably still some squash and potatoes and carrots, parsnips that will store for a while and are available to people through this project. There's also Sportsmen Against Hunger programs where venison, deer meat, and goose meat can be taken into a local processor. And if the people wish to donate it, it can go to a local food pantry. And there's information in each of North Dakota's 8 human service districts, and community action programs in North Dakota host this project, and you can find more on their website. Of course, the Great Plains Food Bank is a place where a lot of people go to get help with food. They support close to 200 food pantries and soup kitchens in our state. They have mobile food pantries. They help people apply for SNAP and some other programs. And there you can find a local food pantry near you, and more information about this if you go to their website under the link that says Get Help. They've also, not too long ago, started doing making diapers available, because we all know that diapers are expensive and families low on resources often need help getting diapers too. So they've also taken on helping people have access to diapers. And just a little bit about the importance of good nutrition, because what you eat directly affects the structure and function of your brain, and encouraging people to eat less of those things that have no nutrition value in them, like pop and candy and chips. Even though they taste good and they're advertising that tells our brain that we think that we would like to eat some or drink some of those, to try and eat and drink a lot less of those kinds of foods. Just encouraging everyone to do the best you can with the resources that you have and the time that you have, with the know-how that you have, and with the support from your family and community and all those partners in our Hunger Free initiative, and doing the best you can. We know that about 9 out of 10 of us in North Dakota could benefit from eating more fruits and vegetables. Again, they have a lot of benefits. We probably are getting enough meat because we're a real meat and potatoes kind of state still, but that's why I love to talk about fruits and vegetables, because it's not the nutrition person saying, don't eat this, but saying, eat more of these things. And then because the cost of food has been going up over the past few months, is becoming concerning to some people, I thought I'd just share some ideas for nourishing foods that are usually less than 20 cents per serving. Just to remind you, and many of you might know this or are already eating these foods, but sometimes we need reminders. Eggs are great, usually 20 cents or less per serving, a good source of protein, vitamins, and minerals. Canned tuna is another one. It's a little, probably doesn't fit into the 20 cents or less per serving category, but 40 cents or less. Again, a good source of protein, healthful fats, like those, they're called omega-3 fatty acids, good for your brain. Guild standby peanut butter or sun butter if you have peanut allergies. Rolled oats and oatmeal. Again, the packaged ones are more expensive and more convenient. But if you just go with your standard round cylinder of rolled oats, have less additives, they might take a little longer to prepare, but they'll be cheaper and you can control what goes in them. Lentils, we grow them here in North Dakota, 20 cents or less per serving. There's some really great soup recipes that use lentils. Also foods from India and other great flavor ideas from some of our adventurous, adding some adventure to our flavors with our meals, recipes for lentils. Dried beans, we grow a lot of here in North Dakota too. Black beans, pinto beans, kidney beans, garbanzo beans. Just pick your favorite and try to eat more of those, canned or dry. Potatoes are 20 cents or less per serving generally. They have protein, they have fiber, they have vitamin C and other vitamins and minerals. Frozen vegetables can be a really good deal too. Just encouraging people to keep stocking up on those and keep your favorites on hand because you can go to those when you don't have a lot of time. And I've just included a real simple recipe for soup with a pound of a package of frozen vegetables, a can of chicken broth, a can of tomatoes, and a can of beans, a few other additional flavorings of what you like to eat and the kind of vegetables that you like to eat. But just keeping some simple foods like this on hand, you can make up a good tasting soup pretty fast. And if you have some meat leftovers from a previous meal, you can throw those in too. There's some good websites to find recipes that are friendly to your budget. One called Eat Fresh, which is the SNAP education program from the state of California. There's another one called Food Hero, which is based in Oregon, which has a lot of good, tasty, healthy recipes and tips. There's a book and a website called Good and Cheap with some kind of different, more adventurous recipes for, again, foods that are lower in cost. Our own NDSU Extension has some ideas. SNAP takes ideas from different programs across the country, and you can find recipes at that SNAP education website. And then I think my newest favorite today when I was preparing for this information is from the state of Iowa, a program called Spend Smart, Eat Smart. And they have really pretty recipes and the pictures of the food online. They even have an app that you can download for free. And the app gives you access to the recipes and a calculator so that if you're in a store and you're trying to figure out which of the packages of food is least expensive, it can help you kind of calculate, because sometimes those food packages are all different sizes and it's hard to say, well, this one costs more per ounce or this one costs less per ounce. So it has a calculator to help you figure that out right there in the aisles of the grocery store. And I will close with that and save some room for questions and get out of this screen. And Danine's going to post all these slides to the website so you can go back and take a peek at those, follow the links, and find more information.
That was great, Karen. I learned several things tonight.
Well, good.
Yeah. Does anybody have any questions for Karen at all? Heather? Anything? Jen? Darlene? Don't be shy.
Everyone's tired.
I know. Yeah. I just think that was fabulous, Karen. Is there a
thanks, Emily.
centralized location that has all of those resources on it? Like if there was a,
Well, oh, I didn't even plug our own Creating a Hunger-Free North Dakota Coalition website oversight there, but on our website we have links to the different SNAP program, WIC program, the data. If you ever need data for a grant or something on food insecurity and hunger, you can find it there. We have a link for our contacting your government offices to take action and advocate for better federal nutrition programs. But as far as like all those recipes, there is not really one link. Well, not really one place.
yeah. Okay. Because we're redoing our new beginnings guide, and I know that originally we had a section on there for some of the SNAP programs, so I'll give this information to them so that they can update the new beginnings guide too. So that'd be good.
Okay, if you ever want me to take a peek at it, or suggest some other things or things, I'd be happy to do that too.
Thanks, appreciate it. Any comments or questions at all for Karen before we say goodnight? And thank you very much, Karen. That was awesome.
You're welcome.
One last chance. Hearing none, we're going to say goodnight to everybody. And thanks again, Karen, so much for doing this. I'm excited to put it up on the website. So,
okay, great. It was
all right.
Good to meet you all.
Yep.
And have happy holidays.
You too.
Good night,
Thank you.
guys.